Hi everyone, and welcome to my channel. My name is Pam. My husband, who you'll meet later, is Larry. We love to travel until my back started getting too bad to do it. So I want to tell you a little bit about us. I met Larry back in 2004 and we were married in 2005. Shortly after we were married, we became truck drivers for 11 years. We loved it. We got to see almost every state in the lower 48s except Maine. We had a blast. We actually sold most of everything we owned at the time and we lived in our truck. We made good money and had no bills. We loved cruising too. We've been on about 20 cruises so far, one every year since we've been married. In 2015, though, my back pain started getting really bad in the truck. I went to go see a neurologist to see what was wrong with my back and was told I had 4 ruptured discs. Tried shots, physical therapy, exercise, nothing worked. So we opted to fuse the 2 middle vertebrae. But ever since the surgery, which was in 2016, I've had leg pain. It comes and goes, and it can get really bad at sometimes. And now it's even started my leg to give out, and I have fallen a few times. I've been medically disabled since 2016 and have not been able to work since then because of chronic back pain. I wanted to discuss how living with chronic back pain can affect people. It's a persistent pain in the back that lasts for 12 weeks or longer, even after the initial injury. It can stem from various conditions such as herniated discs, spinal stenosis, or muscle strain. Unlike acute pain, which is a direct response to injury, chronic back pain can persist without an obvious source, affecting daily activities and quality of life. Managing it often requires a combination of treatments, including physical therapy, medication, and lifestyle changes. For me, the cause was scoliosis. So it is a condition where the spine curves sideways, often in an S shape or just a C shape. The effects of scoliosis are many. There's physical effects, which can change posture changes. You can see it in your waist or your hips. Back pain is more common in adults and varies with severity. You have a reduced range of motion and limited flexibility and mobility. Breathing issues that can restrict lung capacity, fatigue, and muscle strain and imbalance can lead to tiredness. Psychological effects. Self-esteem as visible curvatures can impact your body image. Chronic pain and appearance concerns may contribute to anxiety and depression. Health issues. Severe cases can affect your stomach and intestines. Cardiovascular impact is rare, but a severe curvature can affect your heart. Limitations causing difficulty with physical activities and sports. Adaptations, a need for special furniture or equipment. Long-term effects, the progression of your curve. In some cases, the curve worsens over time. Chronic pain, persistent discomfort requiring ongoing management. Secondary conditions, potential developments of arthritis in the spine. I was diagnosed with scoliosis when I was in high school. The doctor made me wear a brace for 9 months in the hopes that my curve would not worsen. I had no pain at all then. When I was first diagnosed, my curves were 23 and 18 degrees. And now, about 40 years later, they're 48 and 43 degrees. The scoliosis has definitely worsened and has now led me to chronic back pain. There's some tips for managing chronic back pain. Proper posture and body mechanics, importance of regular exercise, including low-pack activities like swimming or yoga, strategies for pain relief such as heat and cold therapy, massage, over-the-counter medications, lifestyle changes to alleviate your back pain, ergonomic workstation setups, weight management and its impact on back pain, mind-body techniques for pain management, mindful meditation and its benefits for chronic pain, deep breathing exercises and relaxation techniques. There's cognitive behavior therapy for managing pain and perception, alternative therapy, acupuncture, which is something that many can use, and I did also for a long time, and then it just quit working. Chiropractic care and spinal manipulation. Before my husband and I began truck driving, I saw a chiropractor twice a week for years. It helped to manage the pain. I even tried a chiropractor when we first had to get off the truck, but once I had the fusion surgery, I was told not to see a chiropractor anymore. There's herbal supplements that can sometimes help in managing chronic pain. I'm now trying kratom to see if it will help with my pain. Preventative measurements to avoid back pain flare-ups, regular stretching and strengthening exercises. There's techniques for lifting objects safely to prevent a strain, creating a supportive environment at home and work to reduce the risk of exacerbating your back pain, seeking professional help. When you consult a healthcare provider for chronic pain, you should go through an overview of treatment options, including physical therapy, medications, and surgery. Since becoming disabled, we've lived in several large cities, and I never had problem getting treatment from pain doctors. The drugs never helped a whole lot, and nothing ever helped my leg pain. In 2020, we moved back to my hometown of Lubbock to care for my mom when my stepdad passed away. I had a heck of a time finding a pain doctor that would treat me there. All they would say is that there's nothing they could do to help me. They wouldn't even see me to continue my medication. I finally found a doctor and had been seeing him ever since. He was the first doctor I've had that gets it. He's tried a couple of injections with no help. We were going to do a pain pump, but the incision opened and I had to do wound care for months and months. So he ended up having to remove it completely. That's when he put me on fentanyl patches. I'd already gotten myself off of gabapentin because it didn't help, and anything else except for I was taking oxycodone for pain, and it didn't really help a whole lot. I think that attributes to the fact that I've had gastric bypass, so pills just don't absorb in my body like they would a normal person. So I was down to the fentanyl patches and like one pain pill and one muscle relaxer, tizanidine, at night to help me sleep. The patches actually helped with my back pain somewhat. Of course, when my leg pain flared up, nothing helped. I had been on those patches for almost 3 years. Unfortunately, he's since retired. His office tried to refer me to other pain doctors, and again, nobody would see me. I had to drive 2 hours away to Amarillo, and when I saw the doctor there, she said I was over-medicated and she would never prescribe fentanyl. She prescribed Suboxone, which helped with the withdrawal, but does nothing for the pain. I used it for 2 months and it never helped. I weaned myself back off of it, and I've been using red kratom along with some leftover oxycodone and tizanidine that I had from before. I'm in so much pain now. All I do is sit and watch TV all the time, which is where I'm at right now, parked on my couch. I can usually get about 4 hours of sleep at night because after that, the pain is so bad, my back will start to spasm. My left leg now feels like it falls asleep, but it aches. So it's just kind of different than just like when a foot falls asleep or something. My husband and I had been planning and saving for years to a trip to Italy. I wanted to go so bad. We were supposed to go last March. We ended up having to cancel our whole trip because the pain got so unbearable. This will bring us to some coping strategies for emotional well-being. Dealing with frustration, stress, and depression associated with chronic pain can be really tricky. And this frustration and depression is what has brought me to fight for myself to find a surgeon that will hopefully fix the problem when he fixes my scoliosis. I sent recent MRIs and x-rays to several US doctors, and I was rejected by so many of them that I started research going out of country. I had doctors in India that were willing to operate right away. They saw the need for immediate correction surgery. While I was waiting on the last doctor to respond, I literally had a flight booked to India the next week. Thankfully, I finally found a doctor in the Dallas-Fort Worth area willing to fight for me, and I'm scheduled now for full scoliosis correction surgery in July, in the hopes that it will once and for all take care of all of this pain, or at least make my life livable again. This is where my story starts on this channel. When I started researching scoliosis surgery at my age, I didn't find very many people on YouTube that talked about their journey. There were a few early 20s or late teenage years, but not any at my age. I'm currently 57 years old. So my journey to correct my scoliosis starts here. I'm going to have my husband help document how I am before and after surgery while I'm in recovery, in order to help those of you that may be in the same position to know what is to come. I'm not going to sit here and tell you that I am totally proficient in what's going to happen. But I do know the dangers of surgery, and I'm ready to fight to try to get my health back. When it's all done, I hope my husband and I can begin to travel again as our retirement is nearing. We didn't get to go on that lifelong dream trip to Italy this year, but we're hoping we can go to Thailand next year. We're very optimistic. We have it already booked, so I'm hoping you'll come along with us on our journey of making me better so we can then take you on our journey to Thailand in January and hopefully many, many more journeys to follow. Thanks for joining me.